welcome to this overview of the Staphylococci species, and the main differences of them could be classified into biochemical and about the morphological features of the colony growth of the agar. Now, of the 12 coagulase negative Staphylococci species that have been recovered as normal commensals of human skin and anterior nerves, the most abundant and important is Staph epidermidis. For this reason, some clinical laboratories designate all the coagulase negative staphylococci as the Staph epidermidis. And this practice, though, is not encouraged, as the second most important coagulase negative staphylococci is the saprophyticus, which has a special medical um, vignette. Coagulase negative staphylococcal species are important agents for hospital acquired infections associated with the usage of implanted prosthetic devices and catheters. Now, the Staphylococcus epidermidis in large number as part of the normal flora of the skin. As such, it's frequently recovered from blood cultures, generally as a contaminant from the skin. Despite its low virulence, it is a common cause of infection in implants such as heart valves and catheters. Acquired drug resistance by epidermidis is even more frequent than aureus. Vancomycin sensitivity remains the rule, but vancomycin resistance isolates have also been reported. Now, the epidermidis produces an extracellular polysaccharide material, sometimes called slime, that facilitates adherence of the bioprosthetic material surfaces, such as the intravenous catheters, and acts as a barrier to antimicrobial agents. Now, an occasional to rare um, frequent disease is caused by the saprophyticus organism, and it causes cystitis in women, probably related to its occurrence as part of the normal vaginal flora. It tends to be sensitive to most antibiotics, even penicillin G. Saprophyticus can be distinguished from epidermidis and most other coagulase negative staphylococci by its natural resistance to novomycin. Okay, now the urinary coagulase negative staphylococcus is often presumed to be saprophyticus. Novomycin resistance can be used for confirmation, and um, we will have the next figure about a summary of the diseases and the treatment. How can I deal with each one? Now, but this summary right here focuses on the species differences related to the biochemical events. For example, the Staph aureus is the only coagulase positive staphylococci. Now it will form golden yellow color colonies, as we suggest the aureus come from golden, and it will ferment mannitol. Now the novomycin resistance is the saprophyticus. Um, this is the organism that's resistant to this antibiotic. Now, the organism that can ferment mannitol is Staph aureus, and the color of colonies in the Staph epidermidis is white. And this figure right here is Staphylococcus epidermidis growing on the extracellular slime on surface of colonized catheter. Now, so we have Staphylococcus aureus, epidermidis, and the saprophyticus. The saprophyticus is the major cause of cystitis in women. How do I deal with it? It's penicillin, simply penicillin G. Now, Staphylococcus epidermidis, we know that it causes infection of catheters and heart valves. The main management of it is oxacillin, nafcillin. Now, if it is resistant, we can use vancomycin, but they are mostly resistant to the penicillin G. We cannot use penicillin G here. About Staphylococcus aureus, that causes all these infections we talked about, uh, either from the intoxication itself, like food poisoning or the toxic shock syndrome, or the SSS, the scalded skin syndrome, or from the colonization itself, like the skin infections, the furuncles, carbuncles, and the folliculitis, or the osteomyelitis, or the endocarditis. They are all they have the same management. We start from penicillins, not penicillin G. We start from oxacillin and nafcillin, then vancomycin, and if it is versa, we can use the streptogramins, the quinupristin and danfopristin, linezolid, and uh, daptomycin. Now, how do they grow? They are round cocci. They tend to occur in branches like grapes, grape-like structures, like grapes. Not all of them, but you'll see a lot of this kind of structures here. This culture from a wound infection. And on a blood agar, they will look yellow. They will have yellow appearance if they are Staphylococcus aureus, or they will have the white colonies appearance if they are Staph epidermidis, and they will show the beta hemolysis on the blood agar. That's highly suggestive of the Staphylococci aureus. Now, these are some patterns of diseases caused by Staphylococcus aureus. This is the folliculitis, okay, of, uh, of a leg, and this is a carbuncle in a hand. This is farnacle also of the hand, and this shows a cardiac pacemaker, and it's colonized by these structures, which is the staph aureus. This is the staphylococcal scalded skin syndrome, and this is the impetigo, the honeycrust lesions that can be caused by streptococcus 2.